As an executive coach and an organizational psychology practitioner, I run a lot of interventions with individuals and teams to optimize their performance on the job. I do a lot of work with healthcare providers and community service providers. And I've been observing a disturbing trend of disrespectful treatment and risky behaviors from community members towards these service providers, which not only depletes the joy in their job, reduces the safety they feel, but also poses a huge risk for the conditions under which they can provide the services that they have committed to providing to you in the community. In this video, I would like to invite you as a citizen to care about the performance of these folks who are essential when it matters the most. Imagine Alex, a dedicated paramedic with years of experience rushing through the chaos of an emergency to save lives. They are committed to making a positive impact on the community, driven by a genuine desire to help others during their most vulnerable moments. One day, as Sarah responds to a call for assistance, they encounter an environment that is not just challenging due to the emergency at hand, but is emotionally charged because of the behavior of some of the bystanders. Instead of offering support, they hurl verbal abuse at Alex and their team, questioning their capabilities and even making inappropriate comments. Alex, despite their training to remain focused, feels the weight of the abuse. After all, this isn't an isolated incident. Unfortunately, it's become a disturbing pattern. The toll on their mental health has accumulated over all this time, and the enthusiasm that once fueled their commitment has started to wane. The very community they dedicated to serving is becoming a source of distress. Now, this story isn't unique. It reflects a growing issue in our society where individuals providing essential services face not only the inherent challenges of their jobs, but also the added burden of mistreatment. As we explore the importance of respecting and safeguarding the well-being of service providers, I hope you will consider the real impact of such actions on the very people who dedicate their lives to our safety and our well-being. I hope this video will be a call to recognize their humanity and the vital role they play in our communities. And what I will share with you is why you personally need to care. And if you feel I've never dealt with a paramedic, well, Alex does not have to be a paramedic. You could replace Alex's story as a police officer, as a healthy sexuality physician in the community, as a nurse or an OT in one of your local hospitals. The sad part is this mistreatment and abuse is pervasive across different categories of service providers. Unfortunately, the higher the stakes, both in terms of the complexity of work that these people are doing, the urgency, and the risk that they face on the job, equally high is the risk that they are exposed to in how people treat them, whether it's verbal abuse, physical abuse, and sometimes also sexual abuse. So let's start with the moral imperative. If I say they deserve to be treated with dignity and respect, I know you wouldn't be surprised. And you probably think, of course, that's how I treat everybody. Well, yes, you probably do, but there are conditions under which we fall short. The amount of incivility that has increased in every environment because people are burnt out. They're so exhausted and depleted from other places that they don't have the patience that typically people used to have, or the grace that they would show each other. So it's not that you're a bad person when you treat another person poorly, but I think it's an invitation to see what conditions are happening in your environment and whether you will let those conditions win. So I cannot imagine, and I'm sure you're with me, there is no job, no person that does not deserve to be treated with dignity and respect, especially these folks who are there for us when we need them most. Along with that is a reminder of our shared humanity. After all, they're people. And if we can remember that in our interactions with these folks, it will change the dynamic of how they show up. It will increase the feelings of safety and mutual respect. That should hopefully create an even more positive work environment for them so that they can take care of us. And if the moral imperative feels very basic to you, I have the performance imperative for you. Why you need to care. 2 parts. Imagine you or a loved one needs help. You call 911 and the team of paramedics that shows up, they seem to be on the edge. They are looking around. They're making sure they're in a safe environment. You want them to focus on you or your loved one. You want them to feel safe and fully immersed and in flow with the work that they need to do. But if these people have constantly experienced horrible things from the community on the job, would you blame them if they're not showing up with their best selves? Their performance in the moment that matters the most to you is contingent on not just how you treat them, but also the cumulative journey of how all the other patrons have treated them. And yes, you may not be able to control their past experiences, but you, when you reach out with respect, definitely can disarm any worry or fears that they may have so that they can focus on the job. So not only your treatment or mistreatment has a direct impact on the quality of their service, there's also a longer impact on possibly how they feel about their profession. Imagine after a series of events where they have been abused at one call after another, how much physical or mental capacity do you think they will have to show up to work? So there may not be enough paramedics to answer your call. Worse yet, some of them may start questioning the purpose of joining this profession at all, or any of the other professions I mentioned earlier. That calling and passion that they felt for the work they do is now questionable because their safety, well-being, and their own humanity is at risk. So as a community member, if there aren't enough people to do the work that needs to be done, so people leaving the profession, retention issue, turnover, but also the quality of service those provide that actually show up on the job, directly impacts you. And it impacts you at moments that matter the most. The second part of this performance imperative is about you as a community. A lot of these service providers travel far distances, move cities and towns to work in other places because they're so passionate about the work that they do. If your community develops a reputation as people who don't care, don't show respect, and worse yet, abuse these service providers, that reputation will disallow you to attract top talent. And that also has economic repercussions for you as a community, because why will people move to this community? Because you need these essential services, and there's a long-lasting impact on your treatment or mistreatment of these people. Now, if you think I'm preaching to the choir, then lucky me. But there is another invitation. If you feel you're doing your part, you always do. May I also ask you to stand up if somebody else is not doing their part? If you are at a community clinic or at the hospital or even at your home, that another person is ill-treating one of these service providers, stand up for them. You have power as a bystander. Stand up rather than just stand and watch what is happening. When you ground your behavior in both the moral imperative, which is rooted in the basic human decency, and in the performance imperative, which is tied to the quality of service, employee satisfaction, and your community's reputation, you have increased the probability of making sure that you get the best quality and performance from these folks in moments that matter the most. So really, upholding respectful treatment of these providers is not just a matter of ethics. It's really a strategic decision that contributes to the well-being of everybody. Those providers, you and your loved ones, and the success of your community at large. If this message resonated with you, take time to thank a service provider. You'll pleasantly surprise them. You know, as a culture, we don't show appreciation enough. And I think it will go a long way in creating the safety that optimizes the conditions for their performance. Besides that, if you think there is another person who may value or benefit from thinking about how we treat and support our service providers in the community, please share this video with them. Thank you for watching and stay tuned for more content.